Good day, everybody. Good morning to those for whom it's the morning and any other time of day. Nice to see you all. After our Tuesday session, where I must say, I think I was trying to work through my own feelings about the news about the Pfizer vaccine and also the shifts in the United States. And I think that, well, for many of us, there were quite a number of issues to work through. The team has spent a good length of time in the interval thinking through how we can just be a little bit more clearer with everybody, the shape of the briefings, and also I spent time this morning with WHO people, just absolutely making sure that we're synchronized in our view of what's happening around the world on COVID. And so hopefully today we will be able to structure things in a way that makes sense to you all. Before I go into the session, I'd like to invite Twee to welcome everybody, and then we will go into the actual briefing. Twee, please. Thank you.
Thank you, David. Hello, everyone. So as usual, I'll be launching a polling so we can find out who's joining us today. If you haven't done this before, you'll see on your window the first question where you're joining from, so please select that. Once you've done that, you can scroll down, select your age range, and then for the last question, please do share how you're feeling with us so we feel the mood of the room, despite being an online meeting. There, you can answer more than once for question number 3, with the more positive emotions at the top and the more negative emotions at the bottom. I will leave that open and we can come back to it later in the session. Thank you very much.
Thank you. Thank you very much, Twee. So I'm proposing that, particularly now with things moving quite quickly and with a lot of quite difficult questions emerging, that we will have a quite regular structure to these briefings. We'll start with an overview of recent epidemiology and any big news that we've picked up. We will then go into more detail into both community and individual aspects of managing COVID, and that's where I will use my own intelligence and also my experience to delve in a bit more detail. And in that regard, in the last 2 months, my own network of fellow travelers on this has increased, and I think that we can offer some really quite useful take on what to do where. And we will always try, wherever possible, to see who's on these briefings and relate to it. So I see Jane Badham has kindly joined us today. So that means that I will pay a bit of attention to South Africa. I see that Miles and Joe are here, and that will mean that I want to keep looking at Kenya. And I see that Haruko's here, which means that some of the very interesting things happening in Japan will get attention. And I know Anne Hendricks Jenkins has got lots of interests actually all around the world, and I will sort of be talking to you as well. I want to try to talk to you individually as much as possible. It doesn't work brilliantly because I don't always manage to do an immediate assessment of who's on. Then I want to go more into the organization of responses, organizations at local level, an organization at national level, organization at global level. And there we've got a narrative that we've been working on with you. It's 7 points now, but it's been oscillating in the last 2 months. And that narrative, the more I test it with different people around the world, the more I think that narrative is meaningful. And so we'll come back to that again and again. But all the time be evolving it as necessary. And that means that I would like you to know that increasingly I want to be sure that these open online briefings are places where we as a small group who are together quite often now can be actually fine-tuning and then adapting our messaging. Because final point in the introduction coming now, this is going on, and it'll go on in different forms, but it's going on for the foreseeable future. Most of the predictions are that vaccines will be coming on stream between Q1 and Q2 next year. And we still don't quite know which vaccines are going to turn out to be the ones that countries will use. But whatever it is, it's going to be a massive logistical and communications challenge. And so there is absolutely no certainty that we will be able to suddenly switch from public health-based control to vaccine-based control. We will have to find ways to align the vaccine work inside our public health work, inside our community-based response work. And because of that, and because it's going to be a very, very delicate messaging challenge, I am convinced that we need to keep fashioning and sharpening and adapting both our messaging and our relationships to move this work forward. So those are my introductory comments. I'd just like to welcome Chris Shipton again. And I hope that you're well. Thank you for joining us. And please, as usual, don't hesitate to share in the chat if there are specifics you want to bring up. We're a small group, and I think we should take advantage of that today. I do keep wondering who is the person who has iPhone Van Anne, A-N-N-E, on her phone. If, Anne, you want to be more visible to us, we would love to know who you are, if you think that will help. So I want to talk a little bit about the epidemiology. It's very, very interesting, and the notes I wrote for myself this morning will be helpful to me. Yes, the global picture is one of a constantly expanding pandemic with this incredible number of cases a day all over the world. And not only that, because of the quite high test positivity rates, including in Europe, we know that almost certainly the case estimates are now very much less than what the actual number is. But the trend lines are there. The rapid rise of cases in some parts of Europe is still going on, whether you're in Russia or Ukraine, Hungary or Poland, Slovakia, Czech, they're all showing quite rapid rises in cases, and mostly in urban areas. But interestingly, although the case numbers in France are rising rapidly, the hospitalization figures for Paris have dropped quite dramatically. And I think what we're seeing in Europe is a really quite quick impact of the lockdown lights that have been imposed. These are not full lockdowns in Europe. They are less stringent than they were earlier this year, but they are having an impact. And I've been thinking to myself, why has it been so quick this time? Why are we seeing a rapid shift in France? Why have the UK increases slowed down? Not completely, and there are still some anomalies in the UK numbers, but they do seem to be slowing. And I think that actually authorities have got a much better understanding of what really matters, when you're trying to get numbers down. And so the focus on trying to prevent gatherings, particularly of a social kind, in pubs in the UK and Ireland, or in restaurants, and to try to limit partying, may not be stupid. They may actually be quite meaningful. Some of the recent epidemiology that's done back analyses from what appear to be spreader events, trying to work out what's going on. Some of these analyses do seem to suggest that socializing, in Europe at least, is a major cause of rapid explosive spreading of the virus. I mean, if that is the case, then what the challenge will be to find ways, when the current phase of lockdowns are eased, to find ways that enable socializing to occur without creating the conditions that lead to the spreading events. That really interests me. So just hold on to that, please, that in Europe, the really dramatic rise that we were seeing 2 weeks ago seems in some places to be starting to plateau. Case study here is Ireland. Ireland was a bit quicker than some of the other European countries to move into a lockdown, a 6-week lockdown, and really very, very dramatic reduction in numbers of new cases. But then we come into the political problem in Ireland, which is, because the numbers are coming down, there's huge pressure in the Irish Parliament for there to be what they're saying a relaxation in restrictions. They have a 5-level system. Level 5 is when you're almost in lockdown. Level 2 is quite mild reduction in meetings and so on. And so the pressure in Dublin is to relax the restrictions because numbers are coming down. And the big public health message that I think people like myself have to keep going on about is that you just can't afford to release your efforts to limit spread too quickly, because then the numbers will just bounce back up again and you've got this yo-yo or seesaw effect. What's the metaphors? So we were discussing that in the team this morning. And one metaphor is this, that you've got a car and you're parked on a hill and you're pointing uphill and you're just about to start the journey. If you release the parking brake too early, your car will slide backwards down the hill. If you release the parking brake at the right time, then you will move up the hill. If you release the parking brake too late, then your car will stall. Well, perhaps that's too complex a metaphor, but I am looking for the right metaphor to make the point that if you've got cases coming down because you've limited movements and interactions between people, then you just need to maintain your efforts to keep the numbers, to keep the population movement limited long enough so that the steps you need to put in place to interrupt transmission and break up clusters and keep the society going, those have got to be there, and just don't relax restrictions too quickly. Now, I also had a discussion with Irish colleagues about one other thing. The Ireland analysis by the Chief Medical Officer suggests that one group that's been very involved in spreading virus in Europe, particularly September, October, younger people. They'd been coming to university and having vacations and generally socializing a lot. And the virus was moving quite actively among young people in Europe. That time, of course, a number of universities then had to impose quite strong movement restrictions to stop big outbreaks building up. But there's a suggestion that there's been quite a lot of spontaneous behavior change by younger people all over Europe. What's the reason for that? So here's the second hypothesis thing to come at you with, that perhaps there is a growing understanding about the unpleasantness of long-tail COVID amongst younger people. The worry that if they get COVID and it's a long one, that they won't be able to do physical activity like normal, or they won't be able to concentrate like normal. And there may be enough people with long-tail COVID around in different communities to actually mean that behavior change becomes easier because people are conscious of what a bad thing it can be. I mean, that's the reality. Here we're in Switzerland. It is one of the hotspots for COVID in Europe, exactly where we are right now. I only know a small number of people who've been ill, and thankfully a small number of people who've died. And yet this is the heavy place. And that's one of the big challenges with COVID, is that its fatality rate is quite small. And so it really isn't like what we were experiencing with Ebola in Liberia, where we were seeing people sort of dying outside treatment centers because they couldn't get in. And it's a very horrible thing when you find people gasping in the street and bleeding from their eyes or their mouth and so on. It has a chilling effect on society. Same as in Zambia during a cholera outbreak some years ago. Same, that terrible feeling of sort of people dying all around you. Jolly well does focus the mind. But for most people, this particular virus, with its rather low fatality rate of 1% or less, it's actually not, it doesn't feel so awful to people. And that's one of the reasons why it may be so hard to encourage consistent behaviors that reduce the spread of the virus. So perhaps a recognition about the unpleasantness of long COVID is beginning to sink in different communities. And perhaps that's having some influence on behavior. These are all hypotheses, but they're things that I noticed that quite a lot of people are looking at. Just I thought I'd go wider. What's happening in the US? Really a very mixed picture. There is the surge of COVID happening in places that have already experienced big initial outbreaks, and that's New York. New York will be hit by a strong surge. Hopefully it won't lead to quite the suffering that we had earlier this year, but we're predicting that'll build up. And so that whole east coast of the US is going to have the Europe effect. But then what's happening in the Midwest? Well, Wisconsin and states in Arizona, they're very, very badly affected by COVID. The interval, this period from between the election and the inauguration of whoever is the next president is coming at a bad time. And we've got a big holiday coming up in the US, Thanksgiving. And Thanksgiving is when social events happen. Many of the US super spreader moments have been as a result of social events. There's a very good account, for example, of a motorbike rally in South Dakota. And so there is a big anxiety that Thanksgiving will be one of these moments when there'll just be another bubble of cases. And this is in a country which has pretty good hospital capacity, but in some parts of the US, hospitals are overloaded, and Texas was the recent area, but all the states in the South and in the Midwest are in difficulty. Now, I did want to mention that between when we met on Tuesday and now, there's one very exciting development in the US. There's a guy called Ron Klain, who I know quite well from, you say you know people well when you've met them a few times, but I remember him because he worked with President Obama, and he was the Ebola Tsar for President Obama. And together with Gail Smith, they really had a huge impact on the American position with regard to Ebola in West Africa. And the American support for the president of Liberia came in just at the right time when things were very, very bad. And the turnaround was quite quick. And it was just because Obama indicated US support for Liberia and her people. But behind that work by Obama was this combination of Gail Smith and Ron Klain. I'm just so pleased that Joe Biden has chosen somebody who knows what they're doing on disease control to be his chief of staff. It's one of the best pieces of news that there could be around right now. And I mean, I just really respect this guy. So that's a good piece of news. And I'm really pleased also in the US to see a lot of advice in the mainstream media about people not worrying about the fact that this year Thanksgiving will be a bit different from usual, and perhaps also prepare for a Christmas light as well in the US. And my friend Bob Levitt, who is such a good commentator on issues US-wise, says it's just so obvious that people should accept that they're not going to have the usual Thanksgiving and Christmas this year, because that will lead to many more Thanksgivings and Christmases. Whereas if they insist on partying and having fun and so on, and then somebody dies, then that would make the subsequent Thanksgivings very different. So I think, let's just say that that mood is just beginning to make its way through. It'd be interesting to see whether or not this time round bubbling cases in the US will reduce. I wanted to go on Latin America, Central and South America. Will they also get a resurgence after they had such a bad time earlier on? Well, I think they will. I don't think anywhere is going to be spread the resurgence. It's just that the scale of the resurgence will depend on how exhausted health personnel are and how well they can respond to the new stresses. But we do think Mexico will go on picking up. The Mexico numbers are rising. We do think that other parts of Latin America will pick up in terms of case numbers. And it's going to be important to keep the public health messages going there. Then I thought we might move across, as well as I've already commented on the Middle East, just to look at the going further east. There's some quite serious news from South Korea, which, although they've got a brilliant system, they have got quite a big uptick. And then parts of Japan, it's not all over Japan, parts of Japan have also got an increase. And mostly it's understood that the circumstances within which these increases are occurring, again, it's mostly socialization. And I think that those need to be looked at. And I've already mentioned about New Delhi, there's a cold snap in New Delhi, plus there's festive moments with the holiday of Dasai and the Festival of Lights, Tika, as it's called in Nepali. This is making Delhi particularly intense. And I'm reading that there's actually quite a major dispute between the government and the judiciary in Delhi, where a plaintiff has brought a case citing government negligence to a bench of justices in Delhi who have ruled in favor of the plaintiff and have said the government just really does need to take more seriously the severity of the problem, in particular to reduce movements in and around the city. So taken together, we have a really difficult situation across the world, but at the same time, there are two things that I think are quite positive. One is that more and more governments are just getting the message that they've got to get their public health right. And number two, more and more people are getting the message that this does require concerted action, and that concerted action is in their hands. But let's just now delve in a bit, because I thought that on each of the issues that we are exploring in our own work, there are things that I can share with you. Number one, in the community, we've always said how important it is to find the virus and to be able to know where the spikes are building up and to be able to anticipate the surges. There's one big problem, and that is that particularly when people are living close together, cooped up together, as we might say, there's a lot of asymptomatic spread in military settings, in barracks, in prisons, in schools, on cruise liners, in nursing homes, in detention centers. Typically, you start with a spike of cases and people with symptoms, but then if you study the community over the succeeding 4 to 6 weeks, you find that actually an awful lot of people have got antibodies, that there is a lot of asymptomatic spread, especially when people are close together. And if you've got asymptomatic spread, then the only way to find the virus is to do mass testing. But mass testing with PCR is incredibly expensive and difficult to do. So what about these rapid antigen tests that are coming on stream? Are they sensitive enough and specific enough to do mass testing? Most of the commentators that I'm in touch with are saying that these rapid antigen tests are probably good enough for the kind of mass testing that is needed. And certainly that is what more and more of the organizations that have got large numbers of people in their jurisdiction, they're more and more looking at using mass testing, but particularly in nursing homes. Here's another problem. You're running a residential home for older people, and you send swabs off for PCR, and the turnaround time for replies, say 3 days. In these residential care homes, within 3 days, you move from one person having COVID to 40 people having COVID, because people just are so close together. Body fluids are everywhere. Staff find it incredibly hard to do very, very fastidious hygiene. Often the facilities are just not properly laid out. It's almost impossible to stop a COVID spreading in one of these settings. So we've got to do two things, therefore. Get the testing close to the place where the cases are. Use these rapid antigen tests if you haven't got the capacity to do PCR, and have a very quick turnaround in test results so that you can then act rapidly to try to reduce transmission. This is my sort of feeling about the testing, and I'm absolutely certain that within the next month or two, there will be a real shift in testing, and that there will be a much, much greater use of reliable rapid tests. It will make such a difference because of the asymptomatics. Now I want to talk about isolation. We say that if people are positive or even suspected positive, they ought to be isolated. Yet there's so much data available now, which tells us that if you ask people to self-isolate, they almost always don't do it properly. Supervised isolation is desirable. Now, we don't probably use the term supervised isolation. We use the term supported isolation because we don't want to imply some kind of mega control. But isolation is not a joke. Isolation is the way in which transmission is interrupted. We've been looking at some of the information from France. Is one of the reasons why, in fact, why French case numbers are going up still quite rapidly, despite the current lockdown that we're all experiencing, is one of the reasons that actually those who are testing positive are not isolating properly. Perhaps so. So I want to keep making a bit of a fuss about the isolation part. You can't interrupt transmission easily without it. On contact tracing, it makes a huge difference if you do contact tracing well, especially when case numbers are down, low, low, low. But if your case numbers are very high, you probably can't contact trace, but you should at least be investigating clusters and trying to find out what the pattern of illness is in a cluster. So even if you can't directly find each chain of transmission, even if you can't be sure that any individual who's got the disease, be sure of where they got the disease from, you at least need to know what your pattern is. You need to know which are the groups of people who appear to be most at risk. Then you can define the cluster and bust the cluster in a way that's done with a lot of support for the people involved. I think getting slick on cluster management is something that we will all need to learn to do. And the kind of detective work that needs to be done is really, really it's sophisticated, but at the same time, it's got to be local. You can't do that detective work if you don't know who's who in your local community, where the meeting places are, and so on. And that brings me to a sort of underlying message on the community, and one that I think Europe is still struggling with. If you want to actually move to a point where people through their behaviors reduce the risk of getting this virus, then the communication from government has to find a way to balance between fear and anxiety and all those emotions that lead us to think we should do things differently, and at the same time, a sense of empowerment, enablement, inspiration, energy, momentum, the positive words. Some people use the word agency. So finding a way to get the balance between fear and confidence, perhaps that's a better word, is good. I'm trying not to use the word hope, because I've seen some big mistakes by European leaders making promises in the effort to try to provoke hope. And so let's say the balance between fear and confidence. But the absolute need in European governance is to be shifting towards a point where public feel that, yes, not only is it in our hands to deal with this, but we have the power. And so I want to work more on this, and I want to help governments take a little bit of a punt, take a bit of a chance, and find a better balance if they possibly can. Again, because of the time, we're talking here about something that will continue through into 2021. Getting your people alongside in dealing with this is going to be so important. You see, the absolute need, according to my colleague Mike Ryan, head of emergencies at WHO, and it's just something that he and I have a real sort of bond on, the absolute need is to try to avoid more lockdowns because of their terrible impact on people, on communities, on livelihoods, and on the sort of general morale of society. It's nothing good about lockdowns. And the thing is, it's a blunt tool with which you can stop the virus from spreading. But you release the lockdown if you've not put other things in place, if you've not got the people on side, if you've not got the public health services in place, release the lockdown, your case numbers will go up again. We know that. So we've seen some progress. There's more being kept open in the current round of lockdowns than was the case earlier this year. But let's keep trying to find a better balance between restriction and people being trusted and capacitated and enabled to do the right stuff. Lockdowns can be avoided if the behaviors are widespread, and at the same time, if there's good public health and if people know what's happening to the virus in their vicinity. The balance between individual empowerment and state enforcement is worth working on as an issue. I wanted to come back now to a little bit on things that I think we need to go on looking at in terms of what really matters. Mask wearing. I think mask wearing is critical and was really pushing very hard for mask wearing to be widespread. I am now thinking hard about whether we need to be more precise about the manner of mask wearing. I've already said that it's deeply frustrating when people wear masks under their noses, or when people just take masks off or put them under their chin when they're in conversation. But do we need to ask more questions about the efficiency of different kinds of masks in stopping transmission? CDC has recently said, that's the US CDC, that masks are valuable not just for preventing people who've got the virus from transmitting to others, but also on the basis of some studies in the US, really lovely, detailed epidemiology. We can now show that people who have been wearing masks in situations where there's a lot of the virus moving around are less likely, much less likely, to get infected than people who don't wear masks. And that the quality of the mask does matter, how many layers and what those layers consist of in terms of fabric, and also how well the mask is fitting on your face. We have a group of engineers who write to us in quite tough language at the moment, saying, do pay more attention to the properties of masks. You can really increase their efficiency in preventing infection. So I'm going to look at that more. I'm absolutely certain that masking not only works both ways, but also the type of masking is matters. And then on to hand hygiene. Evidence from the Southern Hemisphere suggests that the flu season, their winter, which was our summer in the Northern Hemisphere, was much, much lighter than usual. And that's because of a widespread perception that the use of hand hygiene and respiratory etiquette has not only helped to reduce the COVID spread, but also is helping to reduce the spread of other infectious diseases. Not the greatest hand washer in the world myself, so this is a good point for me. And hand washing, probably more important than intensive surface cleaning. Surface cleaning is good, but in some cases we think surfaces get sort of super clean, but hands don't quite get that attention. And all the time, remember, cough etiquette, it really matters. The physical distancing, 2 meters. Well, there are some who say that's not so important now because of thinking that the virus is transmitted by aerosol. But all the evidence that I'm getting from all over the world is that still the primary mode of spread is through droplets. Droplets usually don't travel more than 1 meter. Therefore, 2 meters is good. Keep it going. And WHO people are going on and on about the importance of physical distancing. Of course, it's difficult for the hospitality industry and it's difficult for schools and so on, but we want to keep it up. And then I do want to very much just continue saying we must go on looking at the places where people are most likely to get infected. Do remember about the issue about cold food processing plants. Myself and Catherine Florence have just finished writing a little review paper on COVID in cold food processing settings. We received advice from Ian Norton, our friend in Australia, which was great. And we did the work for the International Union of Food Workers because they asked us to do it. We've perhaps been not quite as quick as we'd like, but we wanted to get as many people as possible to look at it. And it's now out, and I'm really pleased we did it because it gives us a much clearer set of guidance as to what we've got to look out for in the really peculiar circumstances of cold food plants, where there seem to be a lot of factors that make it likely for COVID to stick there. And the same applies to prisons. There's good practice on how to deal with COVID in prisons and residential accommodation of other kinds, and in military barracks and in naval and merchant vessels. We have better information about the risks in these places, and we need to apply that information. When I said we, I mean the world. So there is, I think, a lot of progress there. And just moving to the end on this, I want to stress that this idea of a local community check-in capacity, so that in every community people know of somebody who is a telephone number that they can be in contact with if they get trouble. The notion of connected community groups, whatever they might be, is something that we're continuing to make a fuss about. We're using at the moment a combination of the words web and honeycomb, but whenever I get a chance now to talk to journalists, especially if it's a longer discussion, I'm trying to ease that into the conversation, making the point that that is a defining feature of many East Asian societies, that there are already existing systems through which in any locality there is one or more individual who's the trusted person who everybody knows they can call up if they need help. And we in Europe and North America don't have that, but we need it. And obviously if you've got a church group or if you've got a community organization that's all good, that's associated with a particular set of activities, then there is a network, but it's the connecting together the existing community networks that's the key. So we're really focusing on that. And the second thing we're focusing on is local authority capacity to deal with incidents and respond in a really effective manner. So, okay, so Catherine's just reminded me I've gone on quite a long time. I just wanted to go as far as I could on this, and I will try to maintain efforts to help with technical information as much as possible. Really love to hear reactions from around the world. Chris, do you want to show us what's on your thing so far, and then go to Twee? Wow. The motorbike. Chris, come in. What have you got there? Lots of nice.
Hi. Yeah. I was very interested in your sort of fear and hope balance, because yeah, I mean, I think a lot of it's really interesting how sort of humans can manage like high levels of stress. And I think it's really interesting because that sort of you know, if you can imagine, like if I draw, I'm going to delete this, but if you can imagine, like humans can put up with an enormous amount of stress, right? But it only takes like one tiny, weeny little thing to sort of tip you over the balance into having a complete meltdown, as I know, on a regular basis. And I do think it's interesting, like in recent days, that the ins and outs of it are, you know, complex, but the idea of kind of the sort of shift in the political winds and, you know, perhaps a vaccine and other things is sort of lightening that sort of imperceptible stress mode. And I think that really keys into the kind of idea of getting that balance between fear and hope. And I think, you know, I would really emphasize, broadly speaking, the hope angle, but you know, because I really think that's the way you get people on board with behaviour change in society and narratives and all that kind of thing.
Just need to find a right way to express hope so that it doesn't come across as sort of falsehood. I mean, I'm playing with confidence, but please keep working on it. Secondly, down on the bottom right-hand corner, the ones that the tests that are really being rolled out now are rapid antigen tests.
Ooh, I'll get that sorted.
Thanks a lot. Oh, lovely, Chris. A tweet, please. I like the pictures so much. Motorbike.
Thank you. Just sharing the results now of the poll. Most people coming from Europe, with at least one from East Asia and Pacific, which is great for this time of day. Age range spread mostly around between 50 and 60 years old. And then on how we're feeling, no one super negative today, which is good, mostly around optimistic and hopeful. And then one person selected the top level of joy, appreciation, empowerment, and freedom.
Great. Thank you, everybody. Anne Van Bolowitz, I think I know who you are, but I'm not 100% sure. But you say that you're calling in from a boat and you've got some lovely examples. Do you want to, I know that probably you can't turn on your video. I don't know what your internet is like, but it'd be nice to just hear a couple of words from you if you want to share. If you don't want to, quite understand.
Hi, David and everyone. Yes, I'm indeed on a boat.
Oh,
Gone, muted. You muted by accident.
Okay, my internet is not very stable, but here I am.
Oh.
Yeah, I'm on a boat, which is more or less my home, traveling from the Netherlands, all around the world, and being a consultant. And in COVID, this is possible these days. How strange that also is on the other, on the flip side. Just briefly, these travel restrictions and what they do to the local environment, it's just destructive. It's incredible how, especially those coastal areas, they're deserted places. People have gone from a good employment income to zero. Lots of people also say there is no real support from government. And it really strikes me because in the Netherlands, we have supported KLM, our Dutch national airline, with a huge sum of money. And you see the divide between sort of like our economic buffers or support to local or national economies in comparison to support for countries that cannot afford such support. And I think that is really something that we need to look at, this international lens.
Yeah.
Also, what I think is the ability of these countries to do things well under COVID is immense. Madeira, you arrive with your boat, you're tested within 2 hours, and you get the results within 4 hours for free, to boost the economy, to let tourism or at least some income come into the country. But nobody is almost arriving, which is, you know, a very big dilemma, I think, between us having travel restrictions and their income or their livelihoods are depending on us traveling. Going also to this issue about communication in our countries, I think we had in the Netherlands, we had very big problems there because we said we were not allowed to travel anymore. And then I think 2 days later, our king was heading for Greece on his private jet and had to come back. So a lot of people were very, saying this is almost elite communication. It's not communication that is really touching about the day-to-day lives of the people that are struck most by this, by COVID. So I think that is something that it's not just lip service. I would like to finish, I'm not going to stay on longer, with some positive notes, because I think the positive notes that I've seen as a consultant is that working in developing or with developing countries, the amount of localization is increasing. We can't travel as consultants anymore to all these places. So local consultancy is booming.
Yeah.
And I think that's a very good thing. And we need to harvest those new organizations and be much more modest with our own international NGOs and governments, trying to, to not rely too much on those local organizations. That's about it. We're now in La Gomera, going probably to Cape Verde. So really interested to see how they are dealing with it, and also with the Senegalese government. I'd love to see if we can enter and what their procedures will be. That's it.
Thank you so much, and thank you for connecting. We've seen you on before, and it was the first time I sort of felt that I had the nerve to invite you to speak, and it's wonderful to connect. Thank you, Anne. Lovely.
We know each other from a long time back in the UNICEF executive board and the WHO. What was it called? The DAP program or something like that?
Yeah,
I was the Netherlands official then.
I remember that, yes. Oh, I'm so glad that I've placed you right. Very much indeed. Good luck with the rest of the journey. Please tune in and tell us how you're getting on, and by email or whatever other technique. Thank you very much, Anne. I'd like to go to another Anne, if I may, to build on what Anne van Bolhuis has just said, and that's Anne Hendricks Jenkins, because what you've been helping us to see, Anne HJ, is again this local capacity development, and it's been great. Would you like to give us some thoughts, please?
Sure, thanks. Great to see you all again. I'll make it quick, but I have a sort of inspiring example that just came out this week. As you know, I work with the Movement for Community-Led Development. I work with local organizations across the world. And a few months ago, the African Development Bank put out a call for submissions for civil society versus COVID-19. Lots of our members of our movement applied, and they got 400 responses. They were overwhelmed. And they have 7 finalists they announced this week that offer insight into the power of locally generated, locally driven responses. So I thought it was interesting just how they break it up and which organizations won, including one of the members of one of our chapters. So they have it broken up into categories. And just to give you an example of who won in the categories, sort of speaks to this, what Annie and David were talking about with regards to the diversity of local leadership and the diversity of local institutions, and also the need for integrated responses. So under food and nutrition, there was a group from Central African Republic that addresses the disruption of the meat and vegetable supply chain. In communication and information, our Zambia chapter member called Amos Youth Center won in that area, and they pivoted from providing school scholarships to providing food for the families of the students that they provide the scholarships for, because they already had identified the neediest families in their community and were able to pivot. Under education, there was a group called YIA Engineering Solutions who has created an MIT recognized interactive STEM learning experience for remote populations using only simple keypad phones and radios. And you can imagine that could also be, they've shifted that to address COVID. There's a group from South Africa called Women in Law in Southern Africa that's addressing gender issues in COVID. There's an information technology group called the Civil Society Urban Development Platform in Kenya, which is focused on social inclusivity, multi-sectoral approaches within the urban settings of Kenya. There's under health, there's a group called Pull for Progress in Burkina Faso, which works with one community to provide sustainable programs in health, education, infrastructure, and advocacy. And the group is from that community. And then the last example is a youth theater group that's from Francophone Africa that is using its theater platform to address COVID awareness and care. And all of these things are important, obviously, not only for protection, but also for care, for cluster management. Food security is huge, and also looking into preparing for how to address the vaccine issue as well. So there's a lot happening, and I think it's up to us at a global level to figure out how to enable more of that at scale in some kind of coordinated fashion like the African Development Bank is doing, and also support them, because 98% of these organizations, they either have zero funding or just a few $1,000s. And with a little more funding, they could really exponentially increase their impact on COVID response. So I will stop there.
Can we find out about that off the African Development Bank website? Or did you have to have special information to because there's a lot more I'd like to learn about that.
Well, they just sent out the announcement yesterday, so I can post it in the LinkedIn site and find out. I'm in touch with them, so I can find out more about how they're going to disseminate more information. But it is a model for the world, for sure, and for Africa.
Typically, the amounts of money that these organizations need to be able to shift up into a new orbit, it's not a huge amount of money.
No,
it's
so small.
Yeah.
Even $5,000 will send an organization into the next level of outreach, capacity, impact. It's incredible. I worked with a group in Liberia that just got $5,000, and it's, you know, enabling them to do things that they haven't been able to do. So you can't underestimate it.
Thank you for joining. Thank you for sharing. Like with Anne Van B, now Anne HJ. Lovely, lovely to hear from you both. Now, I've just seen that Ad Spikers has lit up his video. So Ad, I've noticed that, but let me just invite Annie Felton for because I think Annie's going to make a meta comment on some of the stuff we've been talking about. Annie.
Thanks, David. Hi, everybody. Yeah, I'm really interested in political culture at the moment, and that we need to take account of this. So to be really specific, you would talk to the British Labour Party in a different way to which you would talk to our Conservative Party. And the example of that I want to give is that we have a government which is very attached to libertarian principles. And that small state solution really seems to be hardwired into how they think about the world. And so one MP said recently that he was outraged about the restrictions that were coming across because of COVID, because it meant that the government was actually saying who you could sleep with and who you couldn't. Mm-hmm. And so this really says that the responses that come out are sort of unpredictable. And it isn't even about local, it's about these political affiliations and how they view the world. And it makes it means that the language that we use has to be really fine tested against who we're actually speaking to. And it's regional, but it's also those sort of political principles on which we build our lives, and we can't ignore them because otherwise people don't listen. And I'm really struck just by how complicated this is. And as a social developer, you know, I will go with global objectives, but I'm not won over by global responses.
Got it. Global objectives, local responses. Thank you so much, Annie. Because time's tight, I'm proposing to go to Ad Spikers and then to John Atkinson. Just warning you, John.
Good morning, David and colleagues. Can you hear me, David?
Yes, perfectly.
Yeah, first of all, congratulations for your very candid soundbite on CNN yesterday. And I want to mention this to all because I believe these communications are extremely important. And I hope you have seen it yourself. You did a very good plea for the mask, for hygiene. Yeah. Congratulations, it's very well done. And I believe this type of work needs to be continued. We spoke the other day on the food summit. And really, David, I hope also that you can make in your position somewhere the link what this group is doing and this huge challenge in front of us in the run-up to the International UN Food Summit next year. I will did a small piece on how that plays out in Africa. I have sent that paper to you. We make a smaller contribution to a magazine in Wageningen for December. I will also share that with you. But my important point is, David, is Southeast Asia, Vietnam, Laos, Cambodia, Burma, the Mekong Basin. Is there any way that TWE or others can give us a little bit an update and a brief on the next occasion, how these countries are dealing with the COVID-19?
I, first of all, thank you for stressing that there's magic in Mekong, because I think there is. And I know that Han Sen has recently told the people of Cambodia to get ready. He's nervous that that there's been a slackening off in alertness, but my Vietnamese friends are still very strong. So I will try to do exactly that. And we will get a briefing on Southeast Asia later today. And by Tuesday, I hope we will have something. Thank you very much indeed. Thanks also for the CNN. I need to find out what clip they used. That's the trouble, I don't quite know. So we'll check that out. Thank you.
The only money I've got is in the
Okay,
in
just
the
one or two more.
money well near the gear stick.
Warn you, Chris, just in case you say anything. Okay, you put it back on mute. Let's go to John for observations. And John, if you want to bring anybody else in, that's your right. And then I'll let everybody off. John, please.
So I'm, I'm sort of a bit grateful to TWE who put a little note in the chat that we use as a back channel. It's one of the ways we manage this, which said global objectives, local responses, and connecting to what you said at the beginning, David. What we need to do to break trains of transmission. It has long been understood. The challenge is always, how do you do this in a particular place? And, in a particular place, as Annie said, you get different political cultures, different philosophies, you get different relationships between the local organizations. They may be divided by different scales at which they operate. You get different relationships between the different communities and their representatives that are there. But what we have seen, and I think, David, what you've been pointing to and what Anne was pointing to and all sorts of others on these calls, is that where people start to organize and say, so how are we going to get this done here, given who we are, what we know, who we're connected to, then it really does make a fundamental difference. And we've heard the examples from Africa, we've heard examples from Southeast Asia. We came across good examples in the UK this week, David, a university that just took it on itself to run its own test and trace process and got a good grip of case numbers and all of that sort of stuff. So this real emphasis on get organized, get integrated, but pay attention to the relationships. How do we connect to other agencies? How do we connect to other players in the place? How do we connect to people locally? What do they want? What do they need? What are they hearing? And then we will evolve continued responses to the how we get this done. And I think that's going to make a difference.
One of the things that John taught me in our relationship, in our working relationship, has been that there are three vital properties of living systems that we need to always hold on to. And he just exemplified that in his remark just now. It's the relationships between people, the identity that they can share, and then their ability and willingness to exchange ideas and information with each other. And these are mutually reinforcing. I think we're hearing from the two Anns who started today about the importance of investing in relationships and really respecting those relationships, never dismissing anybody, the importance of people's shared identity, working for equity, working for sustainability, working for empowerment. And then you've got that beginning of trust, and then ideas and information are passed on. John, I think you've always believed in this, but do you think more and more you're not just believing in it, but you're practicing it just in your daily work and also in your teaching?
I think for me, it's always been about how do things connect to each other? How do people relate to each other? How do things connect? We spend so much time focusing on individuals, making them heroes or villains. We spend so much time on particular responses. And yet what COVID's shown us is all of this is hugely interrelated. And so the relationships really, really matter. So I spend most of my working life, David, I think, just connecting people to each other. And as you do that, you start to see a pattern of things that gives you a greater agency to get anything done. Because when you see that pattern, you can see how something might work, and people latch onto that quite quickly. So I would just always reiterate, what's going on here? How do you know? Look for the pattern.
Well, everybody, thank you. I think probably we have to stop. There are people on the call who've heard John in different settings. I saw Holly just now. I think she's gone. John, thank you for that. Thank you, everybody. A particular shout out today to Catherine Deland and Twee and John, who worked very hard on just getting us a little bit tighter on the structure of these events and helping me to prepare for them. And that was stimulated by some of you reacting to where we got to at the end of last week and the beginning of this week. And I think where we got to at the end of last week and the beginning of this week was not least because there were some quite disturbing things that happened globally and more locally during that period. And now, as we come out, we've done a bit of rethinking, and we hope you like the new, the slightly shifted structure. Please let us know on the WhatsApp group. And with that, I'd just like to say hello to Polly. What have you done, Polly, with your son's hair? Could be son's hair. Ah, there we go.
Is that better?
Yeah, that's right. That's right. So, hello, Isaac.
Very keen on the new structure. The boys love it.
Right, great. That's good. Just to tell us what's in his picture while I can look at my grandsons who are whining a bit. Chris.
Oh yeah, hi. I'm afraid I got bogged down in political opinions in the chat, but I think the people versus COVID thing was particularly interesting because, you know, it's great to hear that's happening in developing countries, but, you know, that could work in the UK if you think about it. I mean, it's just a nice catchphrase to kind of galvanize public response. It'd be really interesting to see if that took root here.
Thank you very much indeed. What a lovely picture. And once again, we say to Live Illustration, you are so generous, and we are massively grateful to you and the collection of the pictures that I look at quite often.
We always we actually now sort of argue about who gets to come and do these, because, you know, all of us find it really great way to basically get our heads around this whole situation. So it's turned into a bit of a therapy session for all of us. It really helps us, you know, I don't know, manage that balance.
Thank you. Everybody, thank you very much indeed. And Isaac, glad to see you're eating your breakfast. It's excellent. And Otto seems to be in good form. So that's the